at the Department of Nuclear Medicine, Apollo Hospital, Navi Mumbai. Nuclear medicine is a branch of medicine which deals with use of radiopharmaceutical or radioactive medicine for diagnostic and therapeutic applications. In diagnostics, we do scans to assess the function of various organs. So diagnostic scans are done either on a gamma camera or PET-CT scanner. At Apollo Hospital, we have PET-CT scanners. PET-CT stands for positron emission tomography. As the name suggests, the dye which we are using has an ability or a property to emit positrons, that is positively charged electrons, which subsequently give rise to annihilation photon which are detected by the detector. So PET-CT scan has got two components, the PET part and the CT part. The PET part gives us the functional information, while CT part gives us the morphological information. Whenever disease starts, the changes initially occur at the molecular level, then at the cellular level, tissue level, organ level, functional level, and subsequently the changes occur in the morphology, the structure and size of the organ. So PET-CT scan, by identifying changes at the functional level much before those changes occur at the structural level, have an ability to detect disease much earlier than what a routine CT scan would have picked up. So the most common applications of PET-CT scan are in oncology. So whenever a patient is diagnosed with cancer, we would like to know whether the disease has spread to the body, because depending upon the extent of spread, the patient would be initially offered either a surgery, chemotherapy or radiotherapy. Now the cancer cells, unlike normal cells, are rapidly proliferating. The rate of growth is very high, so the glucose requirement is also very high. So the dye which we are using in PET scan is FDG, that is fluorodeoxyglucose. It is very similar to routine glucose molecule, but we add F18 fluorine 18, which makes it radioactive. So whenever you inject the patient with this FDG, it circulates in the body. It is taken up by the normal cells also and by the cancer cells also. But the extent to which it is taken by the cancer cell is going to be much higher than that of a normal cell. So after injecting, the patient is in waiting area for 1 hour. In this 1 hour, the cancerous tissue takes up the dye, but there is hardly any washout. But normal tissues will take up the dye and there is going to be washout also. So at the end of 1 hour, when we scan the patient, the cancerous cells will be seen as hotspot on the scan, and CT scan will help to localize and characterize those hotspots. So this is the basis on which a PET-CT scan is done for cancer imaging. Apart from staging, that is assessing the extent of disease, PET-CT scan can also be used to assess the treatment response. For example, if a patient is supposed to undergo 6 cycles of chemotherapy, we will do a baseline PET-CT scan, and after 2 to 3 cycles of chemotherapy, again a PET scan is done to know whether the patient is responding or no. In case the PET scan is showing good response, then the chemotherapy is continued. In case the response is not good, then the chemotherapy may be discontinued and alternate or second line of chemotherapy is advocated to these patients. So by changing the chemotherapy, you are not subjecting the patient to a futile chemotherapy regimen and subjecting him to additional toxicity. By identifying there is no response, you change the medicine at the right time and patient will benefit maximum from this. Coming to follow-up of the patient, PET-CT, whenever there is disease recurrence, when a recurrence is suspected, when there is lump formation, or there are new symptoms which are coming up, or certain blood tests called as tumor markers are increasing, then in this scenario, to know whether the disease has come back again, and if it has come back again, where all it has spread, again a PET-CT scan is done. So this is called as a restaging application of PET-CT scan. Apart from cancer imaging, PET-CT scan has got applications in infection imaging also. So unlike cancer cell, the inflammatory and infective cells, the macrophages also have ability to pick up this dye. So whenever we have a patient who is having fever for a long time and all the investigations are not helping us to arrive at a diagnosis, then in this scenario also a PET-CT scan can be used. By identifying the infective focus, it can help the tailored treatment to the patient. Apart from infection imaging, it has applications in cardiology also. Sometimes there is infiltrative disease of the myocardium, that is the heart muscles, like sarcoidosis, in which a PET-CT scan can help you to know what is the extent of the disease involvement of the myocardium. It also helps to assess the response. In case a patient has got a heart attack and patient is planned for angioplasty or bypass, it is very important to know whether the remaining heart cells in the affected area, whether it is completely dead or it is still alive. Because if it is already dead, there is no point in doing the angioplasty or a bypass, and patient's function, cardiac function won't improve. However, in case there is any living tissue in the affected area, then by doing a bypass or angioplasty, definitely there is going to be improvement in cardiac function. So this is another application of PET CT scan to identify viable myocardium and to predict whether patient is going to benefit from angioplasty or bypass surgeries. PET CT scan also has application in neurology. In neurology, there are certain conditions in which patient loses his memory, there is going to be memory loss, his day-to-day activities affected, we call it dementia. So there are various causes of dementia. By doing a PET scan and identify certain patterns, we can come to know what could be the cause of dementia in this patient, and accordingly the appropriate treatment would be given to patient. So these were the applications of PET CT scan and nuclear medicine in diagnostics. However, in nuclear medicine, there are therapeutic applications also where radioactive medicine is used to treat the patients. For example, in case a patient has got CA thyroid and has been operated, the thyroid gland has been removed, then to ablate the remaining tissue, a high dose iodine therapy is given. Sometimes patient has got Graves' disease, hyperthyroidism, then again to treat these patients, radioactive iodine is given to the patients. There are certain liver cancers when they are not operable, then Y90 or yttrium-90 based transarterial radioembolization is done, that is done to treat liver cancers. Apart from that, in carcinoma prostate, where most of the chemotherapy or hormonal therapy have been exhausted and patient is still showing disease progression, then lutetium or actinium based PSMA therapy is also advocated, and PET CT has and nuclear medicine has got application in these cancers also. Apart from that, there are special kind of cancer cells called as a neuroendocrine tumor, in which lutetium based DOTA therapy is also advocated. At Apollo Hospitals, we are offering PET CT diagnostic services. We are offering iodine therapy for remnant ablation. We are offering iodine therapy for Graves' disease. We are also offering bone pain palliation in case patient has got metastatic disease. Apart from that, we are also doing lutetium based PSMA and DOTA therapy. Thank you.